I came across a podcast. And honestly, I was very frustrated. I didn't feel like I was doing a good job for my patients. I wasn't like serving them. And I felt like I was just on the surface. I wasn't going deeper. I came across this podcast on adverse childhood events and realized and learned that my state, Arkansas, where I was practicing, was either number one or number two in the country with the highest percentage of adults having experienced at least two significant adverse childhood events, meaning a parent who was incarcerated, early divorce, emotional neglect, physical abuse, poverty, proximity to drugs, right? So these were the patients that I was taking care of. And when I dug deeper, and there was a large, very significant study out of California from Kaiser Permanente that looked at about 16 or 17,000 adults and went backwards and assessed their adverse childhood events and looked at their risks of lung cancer, heart disease, diabetes, obesity. And what we know is that this chronic stress and the chronic high cortisol associated with chronic stress has these long-term effects down the road, not only cardiovascular, but also on how the brain develops and how people process illness and how people feel like they can overcome their illnesses, right? And make the right decisions when the decisions are complex.